what we are going to do is to discuss about the lower limb neurological examination. If in exam it comes at lower limb neurological examination, you have to do both the motor and sensory. Sometime in exam it comes as lower limb motor examination. In that case, you have to skip the sensory part. Okay. So when it comes to the lower limb neurological examination, you need to do the inspection as well as check the gait. Okay, ask the patient to walk, check Romberg sign, as well as do the tandem gait. I'll show everything, and then you check for tone, power, reflex, coordination. That is the full. That will complete the motor examination. For sensory, you have to check 4 modalities: pinprick, cotton wool, vibration sense, and joint position sense. Okay. The other important thing when it comes to reflex compared to the upper limb, there is 2 types of reflex in lower limb. One is the superficial reflex, another is the deep reflex. Superficial reflex is the plantar. You can take the socks off as well, please. And deep reflex is the deep tendon jug. Okay, so let's start. Okay, can you walk a few steps for me, please? First of all, stand up. Okay, you see from the, just come here. Okay, see from the front side. Proper exposure is very, very important in exam. And you walk a few steps for me, please. So when he's walking, you see what is the stance, there is the associated hand movement, whether it's wide waist or not. Now come here and keep your feet together. Okay. Now make sure always support the patient. If they have got rhombus positive, so close your eyes and see whether there is any swaying or not. Okay, that's fine. So he's okay with that. Now, can you just do this one, please? Very good. So that is tandem gait. Try to put your heel as close possible to the toes as possible. Yeah, that's fine. And the other thing what you can do is if you can walk on your heel, please, like this. That's great. And on your toes. Now, that's it. That's fine. Now you can go back. So if you can lie down on the bed. So in inspection, what we need to see if there is any evidence of any atrophy, any changes in the skin, any bony deformity. And obviously for fasciculation, if you just flick the muscle, if you can see that there is twitching of the muscle. So that these are the common things we see in inspection. The next thing, obviously, can you lift your right leg up and keep it up? 1, 2, 3, 4, 5. This is whether there is any evidence of drift. Left one now. 1, 2, 3, 4, 5. So there is no evidence of drift. This is very important because if you see that there is drift on one side, you are sure that the problem is on which side. If the right side is drifting and left side is steady, that means there is weakness on the right side or vice versa. Okay. So that completes the inspection. Next is tone. Tone, obviously, you just relax your limbs. I'm going to check the first of all tone around the hip. Just keep it relaxed. Okay, very good. Just try to relax. So that's the tone around the hip joint. And you check, support it, just relax your.
If it breaks up, so try 01782.
And if you find that there is increased tone, you should check for the clonus. So for example, if there is ankle, if there is increase, you can check. So if you do it sudden movement, then what will happen? It will start to have the shaking movement. That's called clonus. Remember, you get clonus when there is increased tone. So if you find increased tone, you have to check for clonus. The other thing what is important, clonus can be painful. So just make the patient aware about that. And the other thing is, obviously, for if there is increased tone around the knee, you can check for the patellar clonus. So you just do this and push it. Okay. So that completes the tone. Next is the You can do power or reflex. I know that in second year sometimes they say you have to do the reflex first, but it doesn't matter. Okay, so but I'll do the reflex. So what are the reflex you need to do is the knee reflex, ankle reflex is must. You can do the adductor as well. Okay, so see, just relax, and you feel the tendon. That's the. Can you see that? And you look for any.
So I have to do that. Try and complete those over the weekend. It'll probably take me until Tuesday.
Now see this.
Just
relax.
Is there, just
Can you
to
see the
check,
movement?
I've tried to read the guidance documents, but again, this
Very good reflex. Okay. And if you have to do the adductor.
There is a guidance document telling me where I'm first, second, and third assessor. What I haven't found is the document.
You can see that there is
tells
some.
Tells me how to.
Knee and the ankle is a must. Adductor, if you don't do it, it doesn't matter. Okay. So next is the power. Power first of all in the hip joint. So can you lift your thigh up, keeping the leg straight? Okay. Now push it down. So that is flexion of the hip and extension of the hip. Same. Flexion, extension. Very good. Now bend your knee for me to the right side. Now pull me towards you. Now push me back. Good.
Do I submit scores or do I submit comments?
Push me back. Very good. Now cock up your ankle.
Okay.
Push foot. Cock up your foot.
Okay. Oh, in that case,
push it down.
Okay. By the end of the weekend.
So that's the power. Okay. And what is next left is the coordination. Okay. So for coordination of the lower limb, we do one thing we have left is the superficial reflex. Superficial reflex is the plantar. So how do you do the plantar? So see, I'm just going to scratch your sole. Okay, it won't hurt you. So you go along the lateral side and come up to this. So I'm not doing it, but see, go along this up to the great toe. Ready?
I believe it's possible. I think I will talk on the process.
Okay. So that's how you do the plantar. Normal response is it will plantar flex. If it dorsiflex and then all the other toes open up, that's the positive plantar. Okay. In this case, this is plantar is negative. Okay. So that's the reflex, both the deep and the superficial done. Then the last one in motor is the coordination. So can you lift your right leg up, okay, and touch the right heel to the left knee and follow it along the shin?
Yes.
Can you repeat it again? Okay. Can you repeat the same thing with the left side? Okay. So that completes the motor part of the examination. Now you have to do 4 modalities of sensation. One is the first one is the fine touch. So when you do that, can you feel the body? So you do L1, L1 can you feel it at the same on both sides? Very good. So L1, L2, can you feel it on both sides? No difference. Okay. This one, same on both sides. This one, same on both sides. What about this? And this, same. This, and this, same on both sides. And if you are suspecting peripheral neuropathy, then you go from the tip until they can start feeling. Okay. The same with this one. You go like that. So that's the question. And next is the data. Can you feel me? Can you feel the sharpness? Same L1. Can you feel it? Same on both sides. Then it's the L2, L3, L4. Same on both sides. Same on both sides. And same on both sides. Okay. Good. And the next is vibration. Okay. So just can you feel the vibration?
So what are they? So IM1 is the one with the famous question.
So
And 2 and 3.
what I will do, I will touch in the most bony most prominent
I
bone
was in the meeting
distal.
today, but
It's not ideal to do it in the palm because there is the bone is not directly exposed. So I will do it here. Okay.
But I believe that I am one.
Can you feel the vibration? Tell me when it stops.
What's missing in iron 3 comments. Is that right?
Can you feel it? Tell me when it stops. Okay. Are they same on both sides? Good. And last is the joint position same. So hold it. So this is, so see the finger, don't do it like that. Hold it on the side. So this is up and this is down. Okay. Is it up or down? Now? Now? Okay, very good. Now same on the left side. This is up, this is down. Now tell me what is this?
Down.
Good.
Yeah.
That's right.
I'll see what
So that completes the neurological examination of the lower limb. Okay? And it appears that all the his examination is completely normal. Okay, thank you.